Definition: the diverse effect on cardiology event
Ceci
famous
n'est bot
in
Jennifer Guevara.
myocardial infarction, SB trial, event the effect of dancing and cardiovascular and renal evolution in brown population or cardiac or where does this or vascular disease.
T2 inhibitors are used in type 2 diabetes to help to reduce the blood sugar levels. They differ slightly from most anti-diabetic drugs, which work by either increasing the insulin in the body or increasing the insulin sensitivity of the cells of the body. And the objective of increasing the insulin or the insulin sensitivity is to get the body to take more glucose out of the blood and to store it in the tissues. And that's how they reduce blood sugar levels. However, in SGLT2
application in nurses, the cardiovascular safe profile of Dapagliflozin, a selective inhibitor of sodium glucose cotransporter 2 that promotes glucosamine in patients with type 2 diabetes is indefinite. Medication used to treat type 2 diabetes. It is a single product.
Past 2 decades, several studies have highlighted the importance of intensive glucose-lowering therapy, blood pressure control, and statin use to reduce the risk of cardiovascular complications and mortality in patients with diabetes. But the long-term trends of mortality and cardiovascular outcomes of patients with type 1 or type 2 diabetes, as compared with the general population, are unknown. In a study of patients enrolled between 1998 and 2012 in the Swedish National Diabetes Register, a total of 36,869 patients with type 1 and 457,473 patients with type 2 diabetes were included, along with matched controls from the general population. The outcomes that were assessed were all-cause mortality, fatal coronary heart disease, fatal cardiovascular disease, and hospitalization for cardiovascular disease. The rate of all-cause mortality declined among those with type 1 diabetes by 29%, and in matched controls by 23%, a difference that was not statistically significant. The rate of hospitalization for cardiovascular disease decreased by 36% among those with type 1 diabetes, and by 9% among matched controls, a decrease that was significantly greater for the diabetic group. The rate of all-cause mortality decreased by 21% among those with type 2 diabetes, and by 31% among matched controls.
Might be beneficial in heart failure patients who do not have diabetes, because there is experimental evidence to suggest that SGLT2 inhibitors may have benefits that are not glucose dependent. So to do this, we studied patients with heart failure and reduced ejection fraction receiving conventional therapy who were randomized to either 10 milligrams of dapagliflozin daily or placebo. For that primary composite endpoint, we found that dapagliflozin reduced the risk by 26%, and that was highly statistically significant. And both of the components of that composite endpoint were also reduced, so there was a 30% reduction in the risk of worsening heart failure events, and indeed in heart failure hospitalization, that was statistically significant. And there was an 18% reduction in the risk of cardiovascular mortality. That was also statistically significant. We had a number of secondary outcomes, but I will maybe just mention one of those that's important. We also looked at patients' self-reported symptoms using the Kansas City cardiomyopathy questionnaire. What we found with that questionnaire
Can you just go into a little bit of detail about the study, real-world evidence of the effect on glycemic control with relatively simultaneous versus sequential initiation of basal insulin and GLP-1 receptor agonists?
Yes, absolutely. And really, what this trial was designed to investigate is in a real-world setting, what's happening out there in clinical practice for the patient population who has a high A1C, those people with A1C greater than 9%, poor glycemic control. Does the combination of a GLP-1 and a basal insulin initiated simultaneously have a better chance of achieving glycemic outcomes, getting people to goal, as opposed to the sequential addition of those injectables, meaning starting either the GLP-1 or the basal insulin first, and then adding that second agent.
Conclusion. In persons with type 2 diabetes had or were at risk for atherosclerosis cardiovascular disease, treatment with dapagliflozin did not result of higher or low rate of MACE, not placebo, but did result in a lower rate of cardiovascular disease or hospitalization for heart failure. And findings that reflect.
So, what were some of the key findings of this study?
The key finding of the study was the fact that the hypothesis was proven to be correct. For that group of individuals who have high A1Cs, once they start injectable therapy, the initiation simultaneously, and in this study, the definition of simultaneously was in a 1 month period of time. So that the individuals had to initiate a GLP-1 and a basal insulin within a 30-day period of time, and they were compared to individuals who had both of those agents initiated, but in a longer time frame, a sequential time frame. So instead of within 30 days, within sometime within the next year. So what it shows is that individuals who initiated those two agents, a GLP-1 and a basal insulin, simultaneously